Welcome to the Path Study 101 training webinar. This webinar will provide an introduction to the Path Study design and content covering waves 1 through 3. This webinar was created by Westat in collaboration with the National Institute on Drug Abuse and the Center for Tobacco Products at the Food and Drug Administration. This project is supported with federal funds from the National Institute on Drug Abuse, National Institutes of Health, and the Food and Drug Administration, Department of Health and Human Services, under a contract to Westat. Contract number HHSN 271200027C. This training is self-guided. You can advance to the next slide by clicking on the forward button on the play bar or clicking on the table of contents. If you wish to view the closed captioning text, click on the CC button on the play bar. This training module will cover the first 3 waves of the Path Study. Specifically, we will provide an overview of the Path Study design and methods, the data collection protocol, types of data available, and content of the data collection instruments. Lastly, we will review the data documentation available, which can provide more detailed information as you embark on using Path Study data to answer your own research questions. Data and documentation are available at https://doi.org/10.3086/SERIES606. The Path Study is a nationally representative longitudinal study of tobacco use, which is designed to support the Center for Tobacco Products regulatory considerations. The contract is funded through an interagency agreement between the NIH, National Institute on Drug Abuse, NIDA, and the FDA Center for Tobacco Products. The Path Study is administered by NIDA in collaboration with CTP. Westat holds the contract to implement the Path Study work plan, and they have 9 scientific partners to support this mission. Scientific partners include researchers at the Geisel School of Medicine at Dartmouth, Medical University of South Carolina, New York University, Roswell Park Comprehensive Cancer Center, Rutgers University, the State University of New Jersey, University of California, San Diego, University of Minnesota, University of Waterloo. This Path Study timeline shows a graphic displaying the Path Study contract timeline from 2011 through 2024. Each arrow represents a year starting in 2011 through 2017 in the first row and continuing with 2018 through 2024 in the second row. Each line in the timeline represents a Path Study milestone, including the beginning of data collection for each wave and when data files are made available. The Path Study began Wave 1 data collection from adults and youth in 2013. Waves 1 through 4 collected data from adults and youth every year through 2018. Biennial collection is planned for Wave 5, 6, and 7 through 2023. There are a number of key features that make the Path Study unique from other national surveillance studies. First, the Path Study collects data about a wide variety of tobacco products. These images show most of the products, including cigarettes, e-cigarettes, and other electronic nicotine delivery devices, pipes, smokeless tobacco including snus pouches, dissolvable tobacco, and cigars including traditional cigars, cigarillos, and filtered cigars. Youth are also asked about BDs and Cretex, which are not pictured. The longitudinal design of the study allows researchers to track tobacco product use and changes over time, including product initiation, cessation, and relapse. Since the interview asks about a large array of different products, researchers can investigate polytobacco use, switching between products, the emergence of nicotine dependence, and other health conditions that may be related to tobacco use. The PATH study also collects biospecimens from respondents, some of which are analyzed for biomarkers of exposure to various toxicants. Since the tobacco market is continuing to evolve, the longitudinal nature of the PATH study allows researchers to track not only changes in product use, but also changes in awareness, knowledge, attitudes, and beliefs about tobacco products from wave to wave, overall, and by subgroup. The PATH study relies on a 4-stage stratified probability sample design. The image shown here illustrates the process from left to right. The first stage, shown on the left, was to select primary sampling units, which for the PATH study are counties or groups of counties. The second stage was to select segments, which can be thought of as neighborhoods within the primary sampling units, and the third stage was to select street and residential addresses within the segments. Once a residential address was selected, a field interviewer was sent to the address to complete the fourth stage, which was to select the respondents. This is shown in the image after the third stage. The selection of respondents involves a 2-phase screening procedure. The image illustrates the 2-phase screening in green under the 4 stages just described. A field interviewer goes to the address and speaks to a resident over the age of 18. This resident is referred to as the household respondent. The household respondent reports on the tobacco use of all adults living in the household. Step 1 of the screening procedure selects an initial sample of adults for the household. Step 2 of the screening procedure asks these adults about their own tobacco use. The final sample of up to 2 adults per household was selected. The final adult sample oversamples tobacco users, African Americans, and young adults. Additionally, up to 2 youth ages 12 to 17 were selected at random per household. There is no oversampling for youth. The image shows that after the screening, the next step was to interview sampled adults and youth. Not shown in the image, the PATH study also selected a sample of youth ages 9 to 11, referred to as a shadow sample. This sample was selected to refresh the youth sample in later waves of the study. The PATH study maintained contact with their parents until they turned 12, at which point they were interviewed for the study for the first time. This 4-stage sampling design process provides the PATH study with a nationally representative sample of U.S. civilian, non-institutionalized population ages 12 years and older. Full sample and replicate weights were created that adjust for the complex study design characteristics such as stratification, clustering within primary sampling units, and oversampling. These weights were also adjusted for non-response at each wave. When analyzing PATH study data, it is necessary to use the weights to produce results that are nationally representative of the U.S. civilian and non-institutionalized population. If the weights are not used, results will represent the sample, not the population. Special analytic techniques are needed to use the weights. These are described in the PATH Study User Guide. Since the same respondents are followed up at each wave, The PATH study is considered a longitudinal cohort design study. At Wave 1, the total sample included 45,971 adults ages 18 and older and youth ages 12 to 17. The sample includes never, current, and former tobacco users. Wave 1 data collection was conducted by Westat from September 2013 through December 2014. The weighted response rate for the household screener was 54%, and among households screened, 74% completed the adult interview and 78.4% completed the youth interview. Each interview occurs approximately 1 year after a respondent's previous wave interview. This table shows waves 1, 2, and 3 sample sizes and weighted response rates for the adult interview on the left and the youth interview on the right. There is 1 row for each wave. In the first row corresponding to Wave 1, the adult sample size was 32,320 and the weighted response rate was 74.0%. The youth sample size was 13,651 and the weighted response rate was 78.4%. Please note the Wave 1 weighted response rates are conditional on response at the household level. In the second row, corresponding to Wave 2, the adult sample size was 28,362, and the weighted response rate was 83.2%. The youth sample size was 12,172, and the weighted response rate was 87.3%. In the third row, corresponding to Wave 3, the adult sample size was 28,148, and the weighted response rate was 78.4%. The youth sample size was 11,814, and the weighted response rate was 83.3%. Please note the Wave 2 and Wave 3 weighted response rates are conditional on the study member's participation at Wave 1. In addition, the Wave 2 and Wave 3 sample sizes and response rates reflect the inclusion of Wave 1 youth who later became adults and responded to the adult interview, and Wave 1 shadow youth sample members who are between 9 to 11 years old and became part of the study in Wave 2 or Wave 3 when they turned 12. All sample sizes and weighted response rates are available in the PATH Study User Guide. All adults who completed the Wave 1 interview were asked to provide biospecimens. This table shows the number of adults who provided biospecimens in Wave 1 and the number of continuing Wave 1 biomarker core respondents who provided a sample at Wave 2 and how many of these samples were analyzed. The left-hand side of the table gives the information for urine samples, and the right side gives information for blood samples. There are 2 rows. The first is for all adults at Wave 1, and the second is for continuing Wave 1 biomarker core participants at Wave 2. As seen in the Wave 1 All Adults row, 21,801 provided a urine specimen, and 14,520 provided a blood specimen. Please note that in order to be selected for analysis, participants had to provide sufficient specimen for analysis of at least 1 biomarker panel, and the specific sample needed for an assay be available at the time of shipment. At Wave 1, a stratified probability sample of 11,522 adults who completed the Wave 1 adult interview and provided a sufficient amount of urine for the planned analysis, independent of whether they provided a blood specimen, was selected from a diverse mix of 6 tobacco product user groups described in Section 3.1.1 of the Biomarker Restricted Use Files User Guide. All urine and blood specimens provided by these sampled adults were sent for laboratory analysis. These sampled adults constitute the Wave 1 biomarker core. They are asked for urine specimens in each follow-up wave after completion of the interview for that wave. As seen in Wave 2, continuing Wave 1 biomarker core row, 9,012 provided urine specimens that were able to be analyzed at Wave 2. Now that we have seen an overview of key features of the PATH study, let's look at the data collection protocol in a bit more detail. Before each interview, the appropriate consent or assent was obtained. At Wave 1, there were 5 separate instruments, including a household screener, only used at Wave 1, an adult interview, a youth interview, a parent interview, and a mini-interview with the nicotine exposure questionnaire. The nicotine exposure questionnaire was administered with biospecimen collection if biospecimen collection did not occur within 4 hours of the adult interview. The Westat field interviewing staff conduct in-person data collection in households. This means that they knock on doors and ask people to respond to the survey in person. The field interviewers collect interview data from adults and youth, and the youth's parents, and they collect urine from adults. All field staff receive extensive training and support, including self-study, peer training, and in-person comprehensive training. In addition, there is a separate field staff of phlebotomists who collect blood specimens from adult respondents. The blood specimens are collected in person at the respondent's home within 2 weeks of the interview. Data collection relies on a variety of tools, including a laptop computer that is used for interviews, specimen collection kits, and hard copy forms. Once a biospecimen is collected from a respondent, the specimen is packed into a Credo Cube shipper, which ensures that the specimen is shipped cold between 2 to 8 degrees Celsius by overnight delivery to the repository. Once received at the repository, the condition of the specimen is recorded, including completeness, volume, temperature, and integrity. Next, the specimen is processed, aliquoted, and stored at -80 degrees Celsius according to best practice standard operating procedures for each specimen. If selected for analysis, the specimen is sent to Center for Disease Control and Prevention Laboratories and Genway Biotech Inc. for analysis. Analytical results are sent to Westat, who process them for data file release. Now we are going to talk more about the collection and content of the different types of interviews. First, we will go over the parent interview. The PATH study collected data from parents or guardians about youth respondents. The parent interview was administered after the parent gave consent for the youth interview. A parent was asked to complete an interview for each youth respondent, and some parents responded for more than one child. Not all parents agreed to do the parent interview, but virtually all did. Additionally, some parents, 24% at Wave 1, are also adult respondents. It is important to highlight that these parents were not sampled as parents. They are parents of youth that are sampled. This means that the parent data aren't about the parents. Instead, the parents are a source of data about their child. For example, the parents are asked about whether they have a weeknight curfew for their child. This data is representative about youth whose parents have a curfew for them, but not representative of all parents who impose a curfew on their children. The parent is asked a series of questions about his or herself and their household. This includes questions on marital status, the parent and parent spouse or partner's relationship to the child, parents' education, parents' tobacco use, rules about tobacco use in the home, and availability of tobacco products in the home. The parent is then asked questions about the child's health, curfew, grades and attendance, and tobacco use. The parents are thought to provide more objective, valid data about health than the youth provide, especially for younger youth. In addition, asking these questions of the parent means that the youth interview can be shorter. The parent questionnaire also includes questions about whether the child has a parent who lives elsewhere and questions about the amount of time the child spends in the other home and the availability of tobacco in that home. Next, we will review the content of the adult and youth interviews. The adult and youth interviews are very similar, but we will highlight the differences in content as we move through the different areas. Both the adult and youth interviews collect information on demographics such as age, sex, education, race and ethnicity, income or allowance, and sexual attraction. All adults are asked about sexual orientation, while only youth over the age of 14 are asked about sexual orientation. Participants are also asked questions on detailed tobacco use, which includes polyuse and dependence, health conditions, substance use such as the use of alcohol, marijuana, prescription drugs, and other drugs, and media influences such as time spent watching TV, listening to the radio, and using the internet and the use of cell phones and social media. After responding to a few introductory demographic questions, adults and youth are asked about their use of the following 10 tobacco products: cigarettes, traditional cigars, filtered cigars, cigarillos, hookah, e-cigarettes, smokeless tobacco, snus, pipe, and dissolvable tobacco. In addition to these products, youth are also asked about BDs and Kretex. It should be noted that the electronic nicotine delivery system, or ENDS, were relatively new to the U.S. market, and mostly only e-cigarettes were available at the time of Wave 1 instrument design and data collection. For this reason, the Wave 1 instrument asks only about e-cigarettes and does not ask about e-cigars, e-hookah, e-pipe, vape pens, or other types of ENDS. However, Wave 2 and beyond include questions about non-cigarette ENDS products. Next, adults and youth are asked about basic use behaviors for each product, such as ever use, current use, past 3-day use, and past 30-day use. Additionally, to assess awareness of different products, adults and youth are asked whether they have ever heard of all products except cigarettes. In the tobacco use section of the interviews, respondents are identified as never or ever users of each tobacco product. After completing the tobacco use section, ever users are then asked detailed questions about each specific tobacco product they have ever used. They are asked questions about lifetime use, regular use, first use, use of a flavored product, brand, and variety of products used, number used per day, and number of days used in the last 30 days. Adults are additionally asked questions about the length of time since they quit a product if they are a former user, time to first product used after waking, purchasing information, and reasons to use tobacco products. Youth are asked about age at first use, harm and addictiveness perceptions, purchasing information, and access to tobacco products. The interviews also include questions about packaging and health warnings, risk perceptions, and industry advertising and promotion. Advertising recall involves showing advertisements to the respondent and asking a series of questions about them. However, the ad images used in the PATH study are not available to analysts in the documentation. Additionally, youth are asked about peer and family influences and their accessibility to tobacco products. The health section of the instrument is very detailed and includes questions about physical, mental, and behavioral health, as well as healthcare provider and ER visits. This section utilizes components of validated scales like the Patient-Reported Outcomes Measurement Information System, or PROMIS, to assess physical health, and the Global Appraisal of Individual Needs, or GAIN, short screener to assess symptoms of substance abuse and mental health difficulties. There are questions about the respondent's perception of tobacco use on their own health and questions about whether their healthcare providers advised them to not use tobacco. Only youth are asked about sensation seeking and only adults are asked about tobacco use and healthcare utilization. Also in the health section, there are questions about tobacco-related health conditions, heart conditions, lung and respiratory conditions, and cancer. Of special note are the questions about cancer, which allow respondents to indicate which kind of cancer they have had from a list of 30 types of cancer. There are also questions about dental conditions, ulcers, GI bleeding, fragile bones, and eye health. There are questions about whether the respondent is currently pregnant or has been pregnant, the outcomes of any pregnancy, and their use of tobacco and alcohol during pregnancy. For each condition, the PATH study includes questions about diagnosis, age of diagnosis, and for some conditions, medications. There are questions about substance use, including alcohol, marijuana, prescription drugs that are not prescribed for the respondent or are used only for the feeling they provide, and other illicit drugs. Respondents are also asked about whether use of these substances has caused problems for the respondent in the past year. Next, we will review the data file structure for the adult interview as well as the youth and parent interviews. The data file structure is the same regardless if you were looking at the restricted use files, RUF, or public use files, PUF. Each row in the youth parent data file corresponds to one youth who completed the interview. The responses parents gave about their child are included in the youth interview record. In other words, parents do not have a unique record in the file. Each row in the adult data file corresponds to one adult who completed the adult interview. Every record in a data file has a unique record identifier called Person ID. Each identifier starts with P and has a randomly assigned 9-digit number. The Person ID does not contain or reflect any personally identifiable information, or PII, including geographic information. The Person ID for a given respondent will remain consistent throughout the course of the PATH study, both within and across waves. For example, aged-up adults or someone who completed the youth interview in Wave 1, then turned 18, so completed the adult interview in Wave 2, will retain the same Person ID when they move from the youth to adult questionnaire. All variables except record identifiers and variables related to variance structure use the same variable naming conventions. These are designed to prevent accidental overwrites. The 4 boxes represent the components of a variable name. The wave indicator is the first component. The wave indicator always begins with the letter R and is followed by a 2-digit number indicating the data collection wave. In this example, wave 1 is 01. Derived and imputed variables are followed by an additional R to indicate that these are recodes. This is followed by the second component, a modifier, and third and fourth components are optional second or third modifiers moving from broader to more specific descriptors. This first example, R01 underscore AC1003, is a wave 1 variable related to adult, designated by the A, cigarette use, specifically if they now used cigarettes every day or some days. The second example, R01R underscore A underscore P12M underscore CIGS, is a wave 1 derived variable as indicated by the use of R01R, indicating past 12-month use of cigarettes. Administrative, management, processing, derived, external, and imputed variables are named using mnemonic modifiers. Mnemonics are abbreviations, full words, or phrases that represent the content of the variable. For example, R01R underscore A underscore BMI represents wave 1 adult body mass index, and the second example, R01R underscore A underscore FMR underscore ESTD underscore P12M underscore CIGS represents wave 1 former established past 12-month cigarette use. There are a number of derived variables released on the RUF and PUF. These typically fall into one of 4 categories. The first category is tobacco use. These variables indicate the duration or time frame of use for various products. We will see more examples of these shortly. The second category is unit number standardization. Some questions allow respondents to indicate their response in the unit of their choice. For example, you can indicate if it has been a certain number of days, months, or years since quitting a specific product. These derived variables would standardize the responses to 1 unit. The third category is demographics like age, sex, and race, ethnicity. And lastly, on the public use file only, there are recodes that prevent disclosure. For example, variables included in the RUF include more categories for race ethnicity than the analogous variable in the PUF. This table, also found in the restricted and public use files user guides, lists the various mnemonics used in path study derived variables that indicate tobacco use. The first row describes mnemonics to indicate status or type of user. The abbreviations and descriptions are in the second and third columns and include examples CUR for current, EDY for every day, NVR for never, and FMR for former. The second row includes mnemonics related to intensity of use. The abbreviations and descriptions are in the second and third columns and include examples ESTD for established user and EXPR for experimental user. The third row includes mnemonics related to time frame of use. The abbreviations and descriptions are in the second and third columns and include examples P12M for use in past 12 months and P30D for use in past 30 days. In addition, the table continues and also shows a row with the standard mnemonics used to indicate different product types. The abbreviations and descriptions are in the second and third columns and include examples CIGS for cigarettes, EPRODS for e-products, and SMKLS for smokeless tobacco. There are also missing value designations for each variable. These standard missing values have been designed to provide information about why the data are missing. This slide shows two tables. The table on the left side has the reason for missing and the interview variable code. For interview variables, the missing value codes range from -1 to -9. For derived variables, the missing value codes range from -99911 to -99999 as shown in the table on the right. The biomarker restricted use data files, or the BRUF, are structured a little differently than the RUF and PUF due to the nature of the content. Let's discuss in more detail some of the key features of the biomarker data. As shown previously, this table indicates the number of adults who provided biospecimens in Wave 1 and the number of continuing Wave 1 biomarker correspondents at each wave who provided samples and had those samples analyzed. All adults who completed the Wave 1 interview were asked to provide biospecimens. As seen in the Wave 1 All Adults row, 21,801 provided a urine specimen and 14,520 provided a blood specimen. At Wave 2, those selected for the Wave 1 biomarker core were asked again for urine. Only 9,640 of the core provided urine at Wave 2, and 9,012 had sufficient specimen for the planned analysis and were analyzed. A stratified probability sample of 11,522 adults who completed the Wave 1 adult interview and provided a sufficient amount of urine for the planned analysis, independent of whether they provided a blood specimen, was selected from a diverse mix of 6 tobacco product user groups described in Section 3.1.1 of the Biomarker Restricted Use Files User Guide. These groups ensured inclusion of multiple tobacco product users as well as never users. Of the 11,522 adults who were selected to have their urine specimen analyzed, 7,159 also provided a blood specimen which was selected for analysis. Numerous biomarkers of exposure were measured in the biospecimens. Urine samples were assessed for metals, nicotine, and its metabolites, UNICM, polycyclic aromatic hydrocarbons, PAH, speciated arsenic, tobacco-specific nitrosamines, TSNA, and volatile organic compounds metabolites, VOCM. Additionally, serum cotinine and trans-3-hydroxycotinine, SCOT, were measured in blood samples. Additionally, among those who provided blood, the following biomarkers of potential harm were measured. F2-isoprostane was measured in urine, but only among people who provided blood to ensure sample size is roughly equivalent to other biomarkers of potential harm analytes. Also, for those who provided blood, their blood was assessed for high-sensitivity C-reactive protein, HSCRP, fibrinogen activity, interleukin-6, IL-6, and soluble intercellular adhesion molecule 1, SICAM1. All of these biomarkers of potential harm were measured to provide markers of oxidative stress and inflammation. In addition to the laboratory data results, the biomarker restricted use files contain the nicotine exposure questions. The nicotine exposure questions, or NEQ, consist of items asking about recent, defined as past 3-day, nicotine exposure by product. The NEQ also includes questions confirming a respondent's preferred brand stated in the questionnaire, as well as their use of nicotine replacement therapy and prescription drugs. Sometimes, a respondent will have 2 sets of NEQ data to choose from, one from the adult interview, one from the mini NEQ questionnaire if biospecimen collection occurred more than 4 hours after the adult interview began. When asked separately from the interview, data that are gathered closest in time to when the specimen is collected is considered the best. Example: a respondent completes the adult interview and agrees to give a urine specimen, but has to run an errand and schedules the specimen collection for the next day. The NEQ is administered the next day before the specimen is collected, which makes the NEQ data from the second visit the best in terms of temporal proximity to the time of specimen collection. Because the biomarker data contains information from a variety of different sources, the structure is different from the adult RUF and PUF. There are 3 major categories of file types within the biomarker restricted use files: collection files, lab panel data files, and weight files. There can be up to 2 collection files present for a given wave, a urine file and a blood file. However, if blood is not collected from the wave 1 core at a given wave, then the data file is not released for that specimen. The wave 1 and wave 2 data files consist of 13 separate files for each lab panel assay. Examples of the lab panel assays include the biomarker of exposure and potential harm listed previously, like metals, PAHs, IL-6. Lastly, there can be up to 2 weight files present for a given wave, a urine weight file and a blood weight file. Similar to the collection files, however, if blood is not collected from the wave 1 core at a given wave, then the weight file is not released for that specimen. An additional type of data file was recently made available for analysts working with the PATH study data. This is the State Identifier Restricted Use Data File, CRUF. At this time, only files indicating the state of residence for PATH study interview respondents at the time of Wave 1 are available. The PATH study was not designed to be representative at the state level. As such, the state identifiers provided in the CRUF are for the purpose of adding contextual information from external sources of data to enhance the use and utility of the PATH study data. These external data become characteristics of PATH study participants residing in those states and participants in states with common characteristics may be grouped and their outcomes compared to those of participants in states without those characteristics. State identifiers are not to be used for state-to-state comparison or to produce state-specific estimates. Next, let's review the data file documentation available to researchers using the PATH study data. The data documentation for the BRUF and PUF includes the user guide, codebooks, annotated questionnaire, and a crosswalk that compares questions across waves. The BRUF has additional documentation including lab panel documentation, lab procedures, and collection procedures. The CRUF also has a separate user guide. The user guide provides an overview of the PATH study and detailed information on the data files. There are separate user guides for the RUF, PUF, BRUF, and CRUF, but they are not wave-specific. The information provided in the user guides includes details about the sample design, data collection methods, and response rates. The user guide also includes helpful information about how the weights were constructed and how key variables were imputed. The user guides give an overview of the data file structure and also includes appendices with example program code to ensure users correctly use the weights. There is also an annotated instrument for each type of interview, including youth, parent, adult, and nicotine exposure questions, and each wave of data collection. The annotated instruments include explanatory notes, question text with specifications regarding how it is displayed and who it is displayed to, generic images, variable definitions, and a summary of instrument and data errors. Here is an example from the Wave 2 Adult Annotated Instrument. Each box represents one question asked. In the first row is the variable name, R02_AR2050. Next is the question text that is displayed to the respondent, followed by the response options. Each box will also contain the Ask statement to indicate who was asked the question and any special instructions regarding how the question is presented. In addition to the annotated instrument, there is also a master tobacco brand and product guide available. Some questions require a response option to indicate a brand or variety of a respondent's preferred tobacco product. A list of response options is displayed to select from for a number of major brands and products. The displayed list has a thumbnail image of the brand or product package. For the rest, only the text option is displayed. There are many thousands of brands and product combinations. This has resulted in a long list of options, much too long to display in the annotated instruments. Instead, we have provided a brand and product guide that lists them all. The guide includes all the codes for each brand and variety at the product level and also indicates which question the brand and variety appear in. It's a protected Excel file that can be used to look up brands or products or to look up specific codes, and can also be filtered to show only certain brands or varieties. It cannot be edited. Codebooks are also provided for each data file. For each variable, the codebook includes the question and response options, skip instructions, who was asked the question, missing values, and unweighted frequencies for each response option. Here is an example from the Wave 1 Adult Interview Codebook. At the top, the variable name and brief label are indicated. We can see that this is the codebook for variable R01_AC1003. This is followed by the question text and who was asked, The response options are provided in a table along with the unweighted frequency and percent. The total number of valid cases is provided next, followed by another table containing all the possible missing values and unweighted frequency and percent of respondents who were missing data. The crosswalk lists the interview instrument variables and allows an analyst to identify analytically comparable items across waves. Analytically comparable means that the questions were similar, but they may not be identical. Analysts are advised to review the questions across waves to see if they are similar enough for your research purposes when planning analysis. There is also additional documentation unique to the BRUF. The BRUF User Guide contains the information on sample, selection, and weighting found in the PUF User Guide, as well as additional appendices. Appendix A provides information on the brief buccal cell collection during Wave 1. Since buccal cell collection was terminated partway through the wave, there is no accompanying data in the BRUF related to these specimens. Appendix B provides notes on laboratory results that may be relevant to analysts as they construct their analytic sample. Appendices C and D provide variables with coded outliers and example program code for generating popular statistics, respectively. Instead of one codebook per instrument data file, the BRUF contains one codebook for each laboratory panel, as well as for the urine and blood NEQs. There are also additional PDFs with useful information, including a laboratory file inventory, which has the number of records and results on each lab panel data file. Laboratory procedure documents describes the detailed procedures used for each CDC-led assay. Laboratory panel documentation provides the scientific rationale for measuring a given biomarker, a brief synopsis of the laboratory method used, a list of analytes measured, as well as some literature references. Ready to access the data? This concludes the Path Study 101 training webinar. If you are interested in accessing the data, please go to https://doi.org/10.386/SERIES606. Public use files are available to download in SAS, SPSS, and Stata formats. In addition, all of the data documentation discussed in the webinar is available here, as well as instructions for accessing the various restricted use files.